Welcome to the second session of Stone Soup Group's virtual parent conference. I'm Mary Middleton, the executive director here at Stone Soup Group. And so thank you all for joining us today as we continue our discussion about what it means to live a person-directed life. Today, we're going to focus more on learning about how youth can build skills they need to transition into adult healthcare. And Joanne Singleton will be joining us for the presentation in just a couple minutes. Today's session is the second of 4 sessions. They're being held every Wednesday in June at 2 p.m. So we hope that you can join us for all of them. A lot of people worked hard to make this conference possible, especially as we transitioned from what we thought was going to be an in-person conference back in March to doing a virtual conference this month. We have a lot of sponsors who contributed to this. So quickly to thank them, we have the Alaska Brain Injury Network, who has contributed, the Alaska Mental Health Trust Authority, All for Kids Pediatric Therapy, the ARC of Anchorage, the Bering Straits Native Corporation, the Down Syndrome Network, Matanuska Telephone Association Foundation, Matsu Health Foundation, Reading Right Alaska, and CISA, the Special Education Service Agency. And just really quickly, a few housekeeping things before we get started with the presentation. We are recording today's session, and after the whole parent conference is over, those recordings will be available. Everyone is currently muted. The chat box is open, and you are welcome to leave questions or comments in the chat, and Stone Soup Group staff is monitoring that and will address them. Also, Joanne has said that if you have questions along the way, feel free to unmute yourself and ask your questions as we go. She's okay with being interrupted for questions. So please take advantage of that. For today's session, Joanne Singleton is here with us, and Joanne is originally from Scotland and came to the United States 24 years ago as a medical social worker. She started working first in Fairbanks at Fairbanks Memorial Hospital, and then went on to Chicago in 2004. Before she came back to Alaska, she was a pediatric transplant social worker where she became really interested in adolescent healthcare transition. And it's this interest that led her to helping create a transplant transition clinic and the resources for adolescents, their parents, and the healthcare providers for both pediatric and adult settings. It was in 2017 that Joanne graduated with her master's degree in public health, and in 2018 that she came back to Alaska as a program manager for Women, Children's Family Health. At the state of Alaska, she is the program manager for the Metabolic Clinic and Children and Youth with Special Healthcare Needs program. Excuse me. In these roles, she's able to continue advocating for adolescents to have opportunities to develop independent skills for managing their healthcare needs as they prepare to move from pediatric to adult care. So with that, I'll turn it over to Joanne for today's presentation. Thanks, Joanne.
Thank you very much. I'm very excited to be presenting. It is definitely a little different from how we imagined this would be. But yeah, I've got a slide presentation, and I've also got a handout that I'll be referring to, and the handout is available for anybody as well to use. And as Mary said, along the way, if you have questions, feel free to interrupt me. I want this to be an interactive session. So there are some videos that we'll watch. I'm not sure how they'll be for people who are in rural communities, but hopefully you'll have enough bandwidth to be able to see them. They are videos that are available on another website, so that information I can give to people. It's actually part of the handbook, so you can look at those videos separate from the presentation as well. All right, so whenever whoever's in charge of the slides. There we go. Great. Okay. All right. So if we go, yes. So presentation is becoming independent. So really, when we talk about adolescent transition, we talk about it as a time of preparation, time to develop skills and knowledge, and it's more of a process than a one-time event. And when I think of transition, I mean, when you have a child, from the very beginning, they're always transitioning. They're always moving from one stage to the next. And so it's like building blocks. You know, when you've got a toddler, you teach them how to dress and feed themselves so they can become independent in being able to walk and talk and do basic things for themselves. And then when you get to school age, we teach children how to read and write and have social skills and play and be creative and use the different gifts and talents that they have to figure out what they enjoy doing and how to share that with others. And then when we move into adolescence, oftentimes our focus is very much around careers and education and what's coming next after high school. And sometimes we forget that we also have medical needs, we have healthcare needs, or just even learning how to live a healthy life, thinking about long-term health outcomes. We really want to start teaching adolescents, you know, how to cook and take care of themselves, and make healthy life choices too. So this is a great opportunity for teaching adolescents how to do that. And then if they do have special healthcare needs, also involving providers. Oftentimes, if you've got a child who's got a special healthcare need and they've had it since birth, it tends to be one parent is an absolute expert in everything to do with that child. And the child may or may not know what's going on because the parent has done such a great job of getting them to the point of being adolescents that sometimes the parent is so protective as well because they've been successful in getting the child to be an adolescent that it's hard to give some of that control up and allow the adolescent to become part of the process. And also when you have providers who have known your child for the child's whole life, they can sometimes have a really hard time wanting to give up control of being in charge of the child too. But one of the successes of childhood is graduating and becoming an adult, and we celebrate that in the education setting, but we don't necessarily celebrate that in healthcare. And yet when you think about the advances we've had in healthcare over the last few decades, this is a huge success because we have many more children now who are surviving into adulthood who never used to. So this is a great success. So we should be helping to prepare them then to be successful as adults. And if they're going to continue to need supports, being able to identify that before they age out of systems that can help them and guide them and teach them skills on how to do that. And then also with the pediatric providers, being able to put together information that will help adult providers to not feel intimidated, especially if they have a child who has a pediatric diagnosis that's maybe not very common in the adult world. There's oftentimes I've seen adult providers who are just scared to take on a pediatric patient who's becoming an adult because they feel like they might not have the skills to take care of them. So we want to also encourage pediatric providers to be able to put together information that will help adult providers to be successful in that care as well. So if we go to the next slide, please. So as I've said, this is both an exciting and challenging time. Adolescence is a time where part of growing up is pushing boundaries and trying to figure out how to be independent. And we want to be able to encourage that and do that in a safe environment. And that includes around healthcare. When I worked in transplant, one of the things that parents were most worried about was the adolescents taking their their anti-rejection medicine on time. It had to be taken every 12 hours. And so that would oftentimes become the big fight around when the adolescent was taking the medication or not, or if they were sleeping in and then they were late taking it. And so trying to figure out, you're going to, in adolescence, it's a normal part of that development to have some conflict with the people around you as the adolescent's trying to figure out how to become independent and make decisions. At the same time, we also want them to learn responsibility, so teaching them the importance of why you need to take the medicine every 12 hours. What we found when we started our clinic was a lot of the adolescents had been transplanted as a baby, and then they were doing so well that they only came to our clinic once a year for a check. And so they didn't really appreciate what had happened to them as a child, and yet the parents could vividly tell you all the emotions and everything that they went through when that child was first born, and then needing to be listed for a transplant, and then going through that whole process. And so what we also discovered was parents needed to start sharing the medical story that the child had, that the child didn't actually have a memory of. And that helped them, for the adolescent, to understand a bit better why a parent was maybe a little bit overly obsessed from their point of view, in terms of why they got so upset if they didn't take their medicine on time. But from the parents' point of view, it made complete sense given the trauma of having to watch your new baby going through all of that in the first year or two of life. So this is a great opportunity as well as to build on the past while also looking towards the future and trying to decide, what this adolescent wants to do later in life. And obviously, the way our healthcare system's set up, a big discussion point needs to be around healthcare insurance and making sure that, and other benefits as well, and looking at whatever the child's special needs are, the adolescent's special needs are, also making plans for, as an adult, how will you get medications, or how will you get specific tests or equipment or formula, those kind of things that are potentially better covered as a pediatric patient. How are you going to ensure that those things are still going to be covered as an adult? And if you're looking at becoming employed or going to college, and especially if you're going out of state, what kind of insurance opportunities are there in the state that you're going to if you're going for college, or if you need special medical food, is that stuff that's available where you're going? So they're the kinds of conversations you want to start early, before the summer before they're leaving to go to college. It would be ideal to have those conversations starting around 14, 15. And then also setting realistic expectations. And this, of course, can be a challenge because adolescents, they believe everything is possible, which is not a bad thing. We want people to not feel that they are bound by a medical need or a special need that they have, but also trying to not set people up to fail. So how best can we support people to be successful and make good choices that are going to then help them as they're moving from pediatric world and becoming an adult? And so ideally, for healthcare transition, a lot of the models say really to start working on this between the ages of 12 to 14, so having those discussions with your pediatrician or your primary care provider. Because if you only go to the doctors once a year or twice a year, and you start at the age of 12, and you're looking at a child becoming an adult at 18, you've really only got somewhere between 6 and 12 possible appointments. So it's not a lot of time to discuss all of this and try and help adolescents build the skills, and also for parents to feel comfortable that they know what the adolescent is doing and how to support and get their needs met as well. Okay, so if we go to the next slide. please. Thank you. So I just put this slide up. You know, this is our school expectations, and school is very clearly defined. It's very focused. It's there's curriculum. Everybody knows what kids need to do in order to graduate. If people have special needs, and we work on developing an individual education plan or a 504 plan that would help them being able to get the assistance that they need to be able to manage in the class. And then the teachers assign work, and you focus on getting that work done, and then you graduate. So it's a very defined process for how you move through school, and then you graduate, and then you look at what's coming next. If we go to the next slide, I kind of broke down things to think about in terms of health expectations, and what kind of process we should be looking at in terms of when we're doing teaching with adolescents, on how to just better understand themselves, their thoughts, their feelings, their emotions, relationships, and trying to just figure out how best to learn about these things, manage them, and then also figure out how do you seek help if you have trouble with these different things. A lot of adolescence is focused on identity and trying to figure out who you are as an individual, who you are as part of your family, who you are within your community, and then within, you know, the wider community as well. And I mean, obviously right now there's a lot of turmoil going on in the United States and around the world. And it's almost like there's an adolescent process going on where people are just trying to figure out what they think, what they feel, who they are, what's the best way to like interact with themselves, with others, and with the different institutions around them. And so this is a great opportunity for adolescents to just start thinking about and talking about some of this stuff, and doing it with parents as well, and then also asking medical providers how this also fits in. You know, there might be people who have behavioral health needs and have been taking medications, and as they're thinking of moving from school to whatever is coming next, you know, having a discussion about the different medications that they're on and how they benefit them and what they do and what the side effects are really important conversations to have, because with adolescence, it's also a time of just risk-taking. Again, it's part of that boundary pushing and trying to figure out who you are. It's a normal part of adolescence, is you see kids just trying to see what they can do and get away with on some levels. And again, for kids who have special needs or who have medications, experimenting with some of that stuff could potentially be really, really harmful. And so we want opportunities to be able to discuss with an adolescent reasons for being on particular medication and how it helps benefit either physically or emotionally or mentally. And having those discussions can be really important, because what we're trying to do during this time frame is move the adolescent's healthcare away from the parent being the primary person in control to actually having the adolescent internalize the reasons for going to the doctor and the reasons for certain treatments and the reasons for taking certain medications, rather than just being told this is what you need to do. Actually starting to take ownership of and understanding, oh, this can actually help me, and this makes me feel better when I follow this. I mean, a perfect example is we all know we should get 8 hours of sleep a night, and yet so many of us don't. And when you don't, you end up having to wake up early in the morning because you've got stuff going on, it can be really challenging to, you know, go through your day when you're really tired. So just because we know that we should do something doesn't necessarily mean that we're going to do it, even if we know that it's good for us. So it's the same for adolescents. Just because we tell them that this is something good, it doesn't necessarily mean they're going to be driven to want to follow our advice just because we say it will make them a better person. So it's being able to give adolescents the opportunity to ask questions so that they can better understand in terms of their whole selves, like how that makes sense for them. And again, you know, the example I use is the anti-rejection medication. I remember I had a 16-year-old who used to have an argument with her dad every single night for an hour in the kitchen over whether or not she was going to take her medicine. In the morning, there was never an argument because the kid had to go to school. So it was clearly defined. She had a very short window to take her medicine and then she had to leave for school. So it was never a discussion. But in the evening, there was always this big, long, hour-long discussion in the kitchen. And what I came to realize was she actually really enjoyed the time that she spent with her dad alone in the kitchen, but it was a roundabout way of getting the attention that she was seeking. And we just decided it was better if she just took her medicine and then maybe her and her dad actually planned a different activity so that they got the time together that she was looking for. But nobody really realized that because dad was still very much in the mode of, I need to tell you what to do. And she was okay with that because it got her the time that she wanted to spend with her dad. So sometimes you just get into habits and the way that we've developed relationships or the way that we're managing medical care, that sometimes we need to just stop and take a step back and say, okay, what are we doing? What are we doing here? Who needs to be in charge? Okay, and I'll stop. Does anybody have any questions right now before I keep going on? Because I just keep going, but I do periodically want to just stop and see if anybody has any questions. Okay, great. Okay, we'll move to the next slide, please. Great. So decision making. So this is a really important part of like any transition process. Decision making is actually a learned skill. And so we need opportunities to practice making decisions in order to learn how to do it and to do it well. And also to gain confidence and the capacity in different situations to be able to make a decision. And so when you think about adolescents, most of them is just a developmental stage. They're impulsive. So they make decisions based off of a feeling, or in the moment, I'm going to make this decision for good, bad, indifferent. This is just what I'm going to do. And if they're never taught how to think through the pros and cons of a situation or a choice, it can be really hard then as they move into adulthood to be able to weigh the pros and cons in any situation to be able to make a good decision. And adolescents tend to get away more with making poor decisions because they're adolescents and we give them a bit more leeway, but they're also in a more closed environment and controlled environment. So in some regards, you want adolescents to practice making decisions and sometimes even to make poor decisions because they're in an environment where they have adults or a support system around them that can help them when they don't make a good decision. When you look at adolescents when they turn 18 and then they either leave home or they're an adult and parents don't necessarily have access to the medical information anymore, especially if the adolescent chooses not to share that information with them, it can be a bit more scary because then you have an adolescent who is basically in the world, making their own decisions, but maybe not having some of the same support. and potentially the decisions could be more detrimental. And this was part of the reason why I helped start the transition clinic. Transplants started really in the 90s. And so by the 2005, between 2005, 2010, all those children who were transplanted as babies started to age out of pediatrics and go into the adult world. And the adult providers had never seen pediatric patients survive with some of the conditions they had because transplant wasn't around before. And I specifically worked a lot with liver transplant, and we would have adolescents who wanted to experiment with illicit drugs or different substances and alcohol, and oftentimes they would just stop taking the medicine and then we wouldn't see them for a while. And then we had a couple of kids who ended up actually going into liver failure, and because they were 20 and 21, and we hadn't seen them for a couple of years because we'd lost track of them, they ended up going to the adult facility that was literally across the road from where we were. So we had providers over there that we knew, but the way the adult system works in transplant, those adolescents were put at the bottom of the list because they weren't seriously ill, but they were also labeled as being non-adherent because they weren't taking medication and they weren't following up with treatment. And the developmental stage that they were in was not considered part of the assessment in terms of like, did they have a good capacity to know and understand what would happen if they stopped taking their medicines and if they stopped coming for follow-ups. And it ended up that it was really hard for some of these adolescents to get retransplanted because they were being held to adult standards. And I realized that in the pediatric world, on some levels, we had failed these adolescents because we hadn't properly prepared them for moving into the adult world. So that was really the impetus to get us to start having a transition clinic and inviting adult providers to come as well, so that way we could get the adolescents to ask questions about medications and even, draw pictures of like where the liver is and where your heart and your kidneys are and what does the liver do, really basic questions that we all just assumed the adolescent knew, like why drinking alcohol maybe wasn't such a good idea if you were a liver transplant patient. They didn't realize that alcohol is processed in the liver, and they're like, oh. So on a lot of levels, it was the adults just overthinking because you had parents who were so involved and understood everything. We just missed this piece of this education opportunity to help the adolescents better understand their own medical needs and why some of the treatments were being offered the way that they were. And so then it was really great because then we started having these clinics, and we would have a support group as well where the adolescents would meet, and they tended to be from junior in high school up to, I had a sophomore in college. And so they would actually talk to each other about some of the challenges they had. But it was also, for many of them, the first time they'd ever met anybody who had a transplant. And I was in Chicago. I mean, it's a major a major city with several transplant programs in the city. And yet these kids had never met somebody else who was like them and didn't have the opportunity before to have some of those discussions and to help each other see, oh, we're all just the same. So I think that was another part of having some of these discussions, was to give the adolescents the opportunity to meet other adolescents and to have discussions around normal adolescent questions. Like when you go to college and somebody invites you to a party, what do you do? And that was a great conversation for me to just sit there and allow them to to have that discussion amongst themselves. And then if something related to the transplant, to be able to have a discussion then on, you know, even if the whole discussion around alcohol, and if you got drunk, maybe that doesn't affect the transplanted organ as much, but the idea of being drunk could potentially lead to other issues because you lose control. Maybe you oversleep them because you have a hangover the next day. So talking even further around consequences of behaviors and choices, and trying to help the adolescents think how to think critically about the decisions you make in the moment. How does that then affect you in an hour, in 5 hours, tomorrow, next week? And as a way, again, of trying to build capacity, and this idea of not just living for the moment, which so many adolescents just live for the moment, which again, developmentally appropriate, but we want to try and encourage some other thought as well, especially when we're talking about being able to maintain a healthy life. Okay, next slide, please. So in the booklet, if we go to page 5, and this is actually just a summary of the booklet on page 5. So it's beginning when you're going first to an appointment, like for an adolescent. So if you're between the kids between the age of like 12 to 14, and starting to have conversations with the provider, asking them questions about, well, how long can they stay in this pediatric practice for? There are some providers who are very firm, and when the adolescent turns 18, they're then an adult and they need to move to the adult world. There are other practices that will wait until a child, if they're leaving to go to college, they'll maintain the kid within the practice until they graduate from college and know where they're going to go. There's other practices that if the adolescent has special healthcare needs and they're complicated, potentially they may also keep that kid until they're 22, sometimes 24. It may, but some of it may be dependent on health insurance. So it's really good to start having some of those discussions early, so that way you can start to plan. And also looking at doing medical summaries and an emergency plan. I know that's something Stone Soup Group has worked a lot on, obviously during the pandemic, and has really brought to the forefront for a lot of people this idea of how do we plan for an emergency. I mean, we not only have the virus, but we have earthquakes in Alaska, and volcanoes, and other things, other natural disasters that, you know, if the electricity goes out and your child uses a portable dialysis machine or is on a ventilator, like, what is your backup plan if you lose electricity or if you have to move your residence? So they're also good kind of planning questions to have. But even just if your kid doesn't have a complicated need like that, just the idea of can you get, you know, a 3-month supply of medication so that way you have extra medication or extra formula if you need it. With us being so far away from the rest of the United States, you know, sometimes those supply lines can be affected in terms of getting the supplies that we need up here. So making sure there's always enough in an emergency that you have supplies for a while, or being able to identify maybe a local provider who can help if there's problems with that. And then there's also, I mean, it's also a time for the adolescent to start asking questions too. You start encouraging the adolescent to actually talk to the provider, you know, encourage them to ask a question. And that's something I'm actually going to go into a bit further. But, you know, even things like when you go to the doctor's appointment and then afterwards you get a bill, or you tend to either get a bill or a medical summary depending on what kind of health insurance you have. But sitting down with the child and actually helping them to see what paperwork you get after an appointment. And I think the paperwork's still complicated. And I've worked in healthcare. So, you know, an adolescent who's 18 who suddenly gets handed an explanation of benefits and is supposed to figure that out is pretty complicated. So it's also okay to allow adolescents to know that they don't have to do everything by themselves. And as parents, you don't have to completely give everything away to the adolescent. Is more of a balancing act of what makes sense. Things like potentially, you know, taking your medication as they're getting older, that makes sense that the adolescent would do that themselves. Even making doctor's appointment makes sense for them to do that. So like those kind of things, figuring out how you balance, not just throwing the baby out with the bathwater, but like figuring out how do you do it in a controlled way that the child's needs are still met while they're also gaining some independence. Okay, next slide. Okay, developing skills. So I'm going to talk about 3 areas in particular that just as like a starting point for this. Making a doctor's appointment, refilling medications, and asking a doctor or a medical provider questions. And these are 3 really easy areas that adolescents can start to be more engaged in just part of the process with healthcare. And this is good for any adolescent. They don't necessarily have to have special healthcare needs, but for any adolescent to learn how to make a doctor's appointment and refill prescriptions and be able to ask questions, you know, these are good skills for everybody. So next slide. So we're going to have a short video, and the reason I put the video in is that this website is some Healthy Transitions out of New York. They have a whole website with all kinds of different videos for different parts of healthcare. And they're about 2 to 3 minutes long, but they're ideal to share with adolescents to help them just see what the process looks like. So I'm going to encourage all of us to participate in the activity. So basically, this is a young man who's going to make a doctor's appointment. And I basically want you to think about what information does he need before he makes the doctor's appointment. And after the video, I'll ask for your answers. So if we move to the video, please.
Scheduling an appointment. When scheduling an appointment, you should have ready your doctor's name and phone number, your insurance card, and you should also have your calendar nearby to write the appointment in. Making the phone call. Say who you are.
Yes, hi. This is Wayne Smith. I'd like to make an appointment.
Say why you need the appointment.
I have noticed swelling in my ankle and leg for the past 2 or 3 days.
You might be asked when the last time you saw the doctor was, your phone number, your date of birth, and you also might be asked some information about your insurance coverage.
I have Medicaid.
Don't forget to repeat back the date and time of your appointment.
Next Tuesday at 2.
Great. Oh, go back one slide. Okay, there you go. So anybody want to either unmute themselves or write in the chat box? What are some of the things that you need before you make a doctor's appointment? Yep, date of birth. Thank you, Laurie. Your insurance information. Yes, very good. And with that, it's also important if you have a copay to let the adolescent know that you've got a copay, especially like if they're going to an appointment by themselves and they're supposed to give a copay. That would be good information to share. And a calendar, yes. So you can write down the appointment. These are old videos, obviously. I'm not sure who actually has a paper calendar anymore. Most people probably use their phones. But yes, a calendar, brilliant. Okay, so we will move, if you want to move on, yeah. Yeah, there we go, there are the answers. Wonderful. Okay, and now the next video, this is going to be about prescription labels and organizers. So we'll play this one. No test on this one.
Prescription labels and organizers. The next time you pick up a prescription from the pharmacy, take a look at the bottle and make sure you understand the label. The label has important information about how to take your medication. Your pharmacist can explain the instructions if you are not sure or don't understand. The prescription label includes the name, address, and phone number of the pharmacy, the date the prescription was filled, the prescription number, which is the number used by the drugstore to identify the drug for refills. The label also lists your doctor's name, and your name and address. The prescription label also has important information about the name of the drug, the strength of the drug, and instructions about how and when to take.
That's okay. That was just about all of the...
Okay, cool, because I don't know what happened.
Yeah, no, that's totally fine. If you move on to the next slide, we can actually, yeah. So again, that video is available on that website. But I've also, this is a nice little, and this is in the guidebook. But you can do a little quiz with the adolescent, and so each part of the label is marked with a letter, and then you would just put, it's like match the letter with what it is. So, you know, letter A is the name of the person whose prescription it is and your address, while letter C is the name of the medication and the dose. And so it's a good way to get adolescents to start thinking about what medications they're taking, and dosages, and like, you know, on D it tells you, it gives you the instructions for how to take it, and how often. So these can all be important things. One thing I do encourage for anybody who has prescriptions, take a picture of your prescription bottle. That way, one, if you go to the doctors, you're always asked what medications you're on. And if you've been taking something for a long time, oftentimes you don't remember exactly what it is, because maybe you've been taking it for so long that it's just habit. And so, yes, so, you know, taking a picture, then you can just show whatever provider you are seeing. And especially like if you're going to the ER or an urgent care and needing to know that medication information quickly, can be really helpful if it's just a picture on your phone. You can do the same with your health insurance card as well, taking a picture of that just in case you lose it, but having the back and front, a copy of that is important, especially for adolescents. You know, if we don't have multiple health insurance cards, giving them the information so that way they can share that with medical providers when they go is really important. And there's a couple of questions just about the booklet. Yes. Is that Katie that said about the warnings?
Yes.
Yeah. And it's true. I mean, everybody is human. Not everybody is perfect. And yeah, it's important as well to share with adolescents. You know, I know there's the packet of information that comes with any prescription nowadays is massive, but one of the things that's in that packet, it has a description of what the medicine should look like. So the color, the shape, and then oftentimes they have different letters or numbers also prescribed. And that can be really key when you're thinking about a kid who might be changing doses. And so you've got multiple of the same kind of medicine in the house, but maybe you haven't got rid of an old one because maybe you're going up a dose or down a dose for a short period of time or whatever. But being able to recognize that the medicine you're supposed to be on, you can look at it and it looks the way it's supposed to look based off of the instructions on the bottle. So that is definitely an important piece as well to mention. All right, so if we move to the next slide. So this one's a great one. This one's about asking questions. So this is a poor adolescent being forced to actually talk to a healthcare provider.
As far as independent living?
Like many people, Sarah is shy about asking questions at the doctor's office. Her habit is to be quiet until someone asks her a question.
Sometimes I stay real quiet and I don't speak up, and I stare at the person until they catch on and realize that I need help.
So you're kind of shy, right? And well, that's all right. Speaking up is just another skill that people learn.
Speaking up is just another skill you can develop. How? By practicing. Practice.
A little bit of practice and role playing, and that's just another skill that could be helpful to you live a more independent life.
So, next time you go to the doctor or the dentist, think about what you want to say, practice or do some role play ahead of time, and when you get to the doctor's office, speak up.
Great, I love that. So, the next slide. So this is actually part of Ask Me 3. So it's part of health literacy plan. That basically there are 3 simple questions anybody who's going to a doctor or a medical provider can ask, not just adolescents, but it's helpful for people really to be able to understand, like, why are you there? What's the main problem? What do you need to do about it? And then why is it important for you to do it? Because that then helps to move from the provider being the one that understands what's going on and just tells you what to do, and may talk to you in such a way that you are afraid of, like, asking a clarifying question. But it also then, if you're asking these questions, and then before you leave the appointment, actually repeat back to the provider what your understanding of being told is, that enables the provider then to take responsibility for making sure that what they've told you is the correct thing. When I was a medical social worker, I found very quickly, you know, and even I do it, when I go to the doctor, when you go to the doctor, you're going for a reason, and it's either a good reason or a bad reason. So there's already a lot of stress and anxiety that's going on before you even get to that appointment. And then depending on what you're told, you're either really relieved or you're even more worried than before. And when you're dealing with all those different emotions, it can be hard then to hear, listen, understand, and then follow through with what you're being told you should do, because you've got all this information that you're trying to process. So if you're able to like ask these 3 questions, and if we move to the next slide, you'll actually see there's a form, and it's included on the guidebook as well. So it's an opportunity to write down what you're being told, and then at the end to also then discuss, this is what I heard, this is why you've told me I need to do this, and this is how it's going to help me. And if it's not what the provider meant, then it's an opportunity for the provider to correct the way that they communicated with the patient. Like I said, when I worked as a social worker, I often saw providers blame patients for not following their medical advice, but they never checked that the patient really understood what was meant by what they were told, or that we even checked that the patient was able to do what was being asked of them. You know, if somebody's supposed to start a new medication, if they're not able to actually get the medication because maybe they don't have money, or they don't know how to find a pharmacist, or they don't have transportation to go and pick up the medicine, then they're not going to be able to follow through with the recommendation. It doesn't mean that they don't want to do it. It may be that there's barriers that are in the way that are going to make it more difficult. And because of the way medical providers work, they're often busy, rushed, they don't have time, and they're moving on to the next thing, that sometimes patients can feel like they just need to hurry up and get out to an appointment before all of their needs have been fully met. So this is really a great tool to try and help make sure that there's clear communication. And it's a great way, again, of helping adolescents to practice actually being an active part of an appointment. And like I said, it's good for anybody to be able to use, because then you're making sure that you really are going to follow through with what's needed. Okay, the next slide. So we're moving to monitor progress. So in the booklet, there are different checklists and different summaries that you can use as a way of just monitoring how you're doing and setting goals. There's one checklist that I have that's like a shared responsibility chart, and it's ideal to start with somebody who's like 11, 12, 13 years old, and it's like the parent is in charge of everything, and then you move to the parent and the adolescent are sharing responsibilities. So maybe that is on a Sunday, you know, when you're looking at transitioning from the parent being in charge of medications to the adolescent being more involved, getting a pill box is an ideal way of doing that. And then together you would sit down maybe on a Sunday night and you go through what all of the different prescriptions are and how often the medicines are needing to be taken. And then you fill out the pill box together. And then you figure out like the time frame for when those medicines need to be taken. And one way of helping an adolescent become more independent with that is the parent can monitor and see if an adolescent is taking the medicine without nagging them. So it's still giving parents the control of knowing that it's being done, but you're also doing it, allowing the adolescent to take some of the ownership and responsibility for that. So with the transplant patients, they would have to take their meds every 12 hours, and they were allowed a 1 hour window for when they could take it. So we would make the deal that if a medicine was due at 8 o'clock in the morning or at night, they had until 9 o'clock at night to take it. And if it was still in the box at 9 o'clock, it was fair game. The parent was then allowed to nag them about not having their medicine. But the parameters were set out. Everybody knew what the expectation was. It was a shared agreement that they came up with this together. So it's involving the adolescent in part of the process of understanding this is needed, and then this is how we can achieve it without it becoming this constant argument every 12 hours. Let's argue about something else, like how messy your bedroom is, something else fun. So they're the kind of things of just starting to get adolescents more involved, and asking them, like, what's difficult, what, obviously, you know, maybe making phone calls to strangers, especially if you're phoning the doctor to make an appointment, that can be really scary. And so, you know, one of the things that is great with this process is also working with the provider's office to discuss with them. The adolescent's going to call and make an appointment, and it may be kind of painful for whoever is doing the reception. Can they just have as much patience as possible to, you know, help them through that process? So I realize I keep talking, it's almost 3 o'clock. But yeah, if we move through the, basically it's just the checklist that I've been talking about. And the next one is the shared responsibility chart. So you see it's like about pillboxes and medications and who's organizing stuff. The next slide is about the daily and emergency plans. And again, these are all available in the guidebook. And then the last slide is just future topics. So, you know, thinking about access to care and health insurance, learning about consent for treatment. Every adolescent, when they turn 18, becomes in charge of the medical information, and they're the ones that sign consent. So having discussions beforehand is really important in terms of, especially if an adolescent's going to need help with that. And then also confidentiality in terms of, you know, a lot of kids with special healthcare needs, their peers, their friends know all about their medical stuff. And as they're moving from schools and more closed communities into the world, you know, not everything about you needs to be shared with everybody all of the time. And so also helping adolescents figure out boundaries and what's appropriate. When you're applying for jobs, how do you help, you know, share information with a would-be employer if you have special needs without ending your opportunity for getting that job. So, all right, that's it. Questions? We got there. Yeah, I'm not sure how you're sharing resources, Mary or Alex. I don't think it has. I can look on the website and double check. I don't think it's changed since the last time I gave it to you. Let me. Yeah, that's the one. So the link that Alex just added in the chat box is the link to the guidebook. And it has information in there as well about thinking about Social Security. If an adolescent is going to need Social Security as an adult, like how do you think about going about applying for that? And health insurance as well, you know, pediatric or children are able to have Medicaid, Denali Kid Care until the day before they turn 19. So they need to really apply for Medicaid as an adult 2 or 3 months before the health insurance is going to end, and also make sure you work to get all of the medications and any other formulas or any medical equipment that you need before your insurance ends, in case there's a lag between one insurance ending and another one starting. Yes, whoever L. Davis is. One of the my favorite questions when I would begin having these discussions with parents in clinic, and we would do it just in a clinic setting, so generally be both parents and the adolescent, and we'd start around 14, and it would generally, most of the time it was mum who was in charge of everything. So I would look at mum and I'd say, you have fallen over, you have banged your head, you can remember nothing. And then I would look at the dad and the kid and I would say, what's the name of the hospital? What's the phone number for the hospital? What pharmacy? Like, just really basic questions. And it was this really great eye-opening way of helping them recognize the parents had done an amazing job of getting this kid to be an adolescent, and the kid was doing really well and all of their needs were being met, but it was met by a very tightly run ship that only one person had all of the information, and it was all in her head for the most part, or sometimes in her phone, and nobody always knew the code to get into the phone even, so that would be a problem. So it was just a really easy way to help people recognize that some of this information, it wasn't that they were being a bad parent by starting to give that information away. It was a control thing, and I also recognize that a lot of parents, a lot of them have unresolved trauma from when the child was little, and all of the medical stuff for all of the years that you've been advocating for and fighting to get what a kid needs. And as great as it is to suddenly have this kid be an adolescent and be thinking about them getting ready to become an adult, it's also really terrifying for the parent because they're so afraid of what's going to come next. And that's completely normal, and that needs to also be recognized and talked about. It shouldn't be a reason why a parent doesn't help an adolescent learn stuff. But also with part of this, for some of these kids, they didn't know their story, so they didn't know how bad it was when they were born. And then for the parents to sit and actually talk about what it was like in front of the child who had never heard the story, it got really emotional because suddenly they were sharing a part of the child that it helped the child to understand why the parent was the way that the parent was and why they were so incredibly protective of some aspects of their care and their life, because they had so much invested in this and so much emotion, which had also never really been talked about, because once you got over the initial stuff, life continues. Like, people who have kids in the hospital, they still have to pay bills, they still have to go to work, they still have to take care of other children or other family members. And so it's not happening in isolation, it's happening within this whole other story. And oftentimes, until you get to the adolescent area or time, you haven't really stopped to think about what's come before. So it's a great opportunity for parents as well, just to talk about what's happened and then to help them, understand and realize their strengths and all the stuff they've gone through to get everybody to this point.
Are there any other questions for Joanne? No? Yeah, thank you so much, Joanne. We appreciate you being here today and adapting to our new virtual format.
Oh yeah, no, you're very welcome. I love this topic.
Yeah, And next week's topic is with Roy Scheller, who's the former CEO at Hope, and he'll be talking about the dignity of risk, and it will continue a lot of sort of where we ended today about allowing our children to make decisions and to make mistakes for themselves.
Right.
So we will kind of pick up where we left off today, and so that's next Wednesday, 2 p.m. And if you aren't registered for that, you can register on our website. And then following the presentation today, everyone will get an email with an evaluation. So I really appreciate all of your feedback about how this is working or not working and what could be done differently. This is new for all of us as we make this transition to providing virtual training. So we really do appreciate your feedback and input that you have so that we continue to meet your needs as we deliver these trainings. But thank you again, Joanne. We really appreciate you being here. And we'll make sure that everyone has the link to the handbook as well.
Wonderful. Yeah. And I'm always open for feedback. So if there's something that, wasn't explained well enough, I mean, I talk about this a lot, so sometimes I just get on a roll. But I love adolescence because it's such an exciting time. Like, they're just beginning to become people who have their own ability to make their own way in the world. And just because somebody has special needs doesn't mean that they shouldn't have the same opportunities. They just sometimes might need more support in order to be able to do things that they want to do. And we need to give them the opportunities to learn those skills so they can be successful.
Yeah, absolutely.
Yeah, great.
Okay.
Well, thank you very much for the opportunity. I really appreciate it.
Thank you, Joanne. It's good to see you.
Yes, I know. It's nice to see people.
Nice to see faces.
All right. Take care.
Okay. Yeah. Thank you, everybody.
Thank you, Joanne.
Thank you. Bye.